Hello everyone, welcome back to my channel. I'm Dr. Arif Akhtar, and today we will be diving into an incredible topic that has completely revolutionized surgery, particularly the uro-oncological surgeries. And that is the role and the benefit of the robotic surgeries in managing prostate cancer. So in this video, we will be exploring how robotic technology has transformed the patient care, precision, focusing on surgical outcomes, recovery, and the quality of life after the surgery. So why prostate cancers demand precision or complete, we need to be precise enough. So the prostate cancer is one of the most common cancer among men worldwide. As per the global cancer statistic data 2020, over 1.5 million new cases were diagnosed, making it the second most common cancer in men after lung. So treating prostate cancer, especially with the surgery, if we are talking about the prostate cancer in which we diagnose the cancer in very early stages and which is still limited to the prostate area, is challenging because of the prostate locations and its close proximity or relationship to the critical structure like the urinary control mechanisms, the neurovascular bundles, and the structure and very much closely located nerves. So preservation of these structures are very essential for gaining a urinary control and sexual functions after the surgery. So from that aspect, this is where the robotic surgeries, particularly the robotic-assisted radical prostate surgery, has made a game-changing impact. So earlier it was done through open approach, then we switched to a laparoscopic approach. Now the recent introduction of the robotic surgery has completely revolutionized this radical prostatectomy approach. So what exactly is the robotic surgery? So there are multiple myths and confusions on the part of the patients. Generally they talk about that the robot is doing surgery. No. The robotic surgery uses advanced robotic platforms, or we call it arms, controlled by a surgeon via a surgeon console. So these systems provide a very high definition, or we call it ultra high definition 3D visualizations, and instrument mimics our wrist 7 degree of the wrist movement with unmatched precision. So this is particularly advantage is in very confined and a closed pelvic space in which it's always very difficult to reach up to the area of the prostate. So now conclude what are the different benefits of robotic surgery for prostate cancers. So as I have told previously, the first and the foremost is the enhanced surgical precision. Now these robotic systems or the robotic arm dexterously allows the surgeon to perform the precise dissections, preserving the critical structures, we call it a neurovascular bundles, and preserving the urethral length. So a recent meta-analysis which was published in 2023, last year only, the Lancet Oncology, compared the robotic-assisted prostate surgery to open or laparoscopic method. This was a complete meta-analysis summarizing all the major publications on the same topic. The study found that the robotic surgeries significantly reduce the positive surgical margin, which is very important, as well as the oncological principles and the outcomes are concerned, which is an important indicator of the cancer control, with rate as low as 10 to 15% as compared to 25% in the open surgery. So the second most important is the improved cancer control. Robotic systems enables meticulous removal of the prostate glands and the surrounding tissues. Now this improves the total oncological outcomes in terms of overall cancer specific survival, overall rate of the positive surgical margins, ensuring better long-term cancer control. Now this, I'm quoting very recent European urologist systemic review which demonstrated that the robotic prostate surgery results in a lower biochemical recurrence rate compared to the open surgery, approximately 8% versus 30% at 5-year post-surgery. So this was a comparison between the robotic surgical approach to open surgical approach, and the overall biochemical recurrence, which means the rising serum PSA after the prostate surgery, was substantially better in the robotic arm. Now coming on to the most important aspect of the pentafactor as far as the robotic prostate surgery is concerned is the better functional outcome. So one of the major concern of the prostate cancer patient is the impact on urinary incontinence or the continence and sexual functions, that is the restitution of the sexual functions. Now the robotic surgeries excel here as well. Now if you talk about the urinary continence mechanism, studies have suggested that over 90% of the patients regain their urinary holding capacity within 12 months after the robotic prostatectomy. In our experience, we talk about about 92% will have within 3 months. Now this is largely attributed to the precision in preserving the urinary sphincter mechanism or the control mechanisms and the surrounding tissue. Now the second most important part of the pentafecta is sexual function restoration. So the nerve sparing capacity or the capability of the robotic arms are unparalleled. As per the research which is published in the Journal of Urology in 2023, highlights that up to 70% of the patients which were previously sexually active regain sexual functions within a year, particularly when nerve sparing technique or approach were employed. Now the fourth most important as far as the robotic prostate surgery is concerned is we minimize the blood loss and the faster rate of the recovery, as well as the lessen the hospital duration. Robotic surgery significantly decreases the intraoperative blood loss as compared to the open surgery. If we take an average of 200 ml versus almost a liter in the open surgery, so the patient experiences shorter hospital stay, less amount of the pain, often generally get discharged in 1 or 2 days, and quickly returns to normal physical activity. Maybe it is a normal daily activity or office activity. Now, I'm just quoting a very recent study which was published in JAMA Surgery 2021, found that the robotic surgery patients return to the baseline physical functions nearly twice or maybe twice as fast as those undergo open surgery. So these are some of the important comparison between the open, the robotic approach to a prostate cancer. Now let's discuss about how robotic arm enhance the surgical outcomes. So the robotic arm systems or the robotic systems, there are multiple robotic systems available in the market. Articulate instruments replicate the movement of the human wrist, but with greater precision and stability. The important thing is that's how this helps. Now the thing is, it provides for a very high definitions, 10x magnified 3D views, which allows the surgeons to identify and protect key structures like nerves and the blood vessels, which is key for the recovery of two major important outcome of the surgery, functional outcome, that is the restoration of the sexual functions and urinary control mechanisms. Now these arms are having a very steady movement. So the robotic arms, there is eliminate the risk of that fine tremors that the surgeons may have, ensuring precise and stable maneuverability, if I talk about that thing. Access to difficult areas. Now the pelvic, the most important difficult area as far as the laparoscopic or the minimal invasive surgery is concerned is the pelvic cavity. Robotic arms make this much easier, leading to better outcomes. Now these are the benefits that the surgeon enjoys using a robotic platforms to operate on a patients with this cancer of the prostate. Now there are certain patient specific or the patient center benefits from the patient's perspective. Now what are these benefits? If I summarize it in a very numerical way, then the first and the foremost is the less amount of the pain. The smaller incisions mean less post-operative pain, less requirement of the post-operative analgesia, decreased need for pain medications, and of course the faster recovery. Now there is one other theoretical cosmetic benefits, that is the minimal scarring and due to smaller incisions, faster recovery. Most of the patients generally get discharged within 2 to 3 days and resume their physical activity, whether it is a normal daily routine activity or the office works. Now this has been for years now. Now let's talk about some of the features of the robotic surgery. So this robotic surgeries have evolved in the last 1 decade in a way better as the technology continues to evolve, and we are seeing even greater advancements such as augmented reality integrations and artificial intelligence, which could further enhance the surgical planning and executions. Now this artificial intelligence and augmented reality integrations into the robotic platforms is very critical. So there is a multiple ongoing research which is focusing on redefining the technology or the technique to improve the functionals and the oncological outcomes in cancer prostate patients even further. So in conclusions, I want to suggest that the robotic surgeries has undoubtedly transformed the way we treat prostate cancer. By improving the surgical precisions, reducing the complications, enhancing the recovery, enhancing the functional outcome after the surgeries, it offers patients a better quality of life post surgery. And for the surgeons, if I say it benefits the surgeon more than the patient himself, for surgeons is a powerful tool that enable us to achieve optimal cancer controls, that is the oncological control, while preserving the functional functions, especially the urinary continence as well as the restitution of the sexual or the erection ability. If you found this video informative, please give it a thumbs up and share it with someone who is planning or who is being diagnosed with a cancer prostate, so that make a point in going forward with the prostate radical or the robotic assisted radical prostate surgery. Thank you for watching, and I will see you in the next informative videos. Thank you.